Ever wondered why some people find it hard to breathe? It could be due to a condition called chronic obstructive pulmonary disease, or COPD for short. Imagine, if you will, a pair of bellows constantly expanding and contracting, pushing out old air and drawing in fresh. That's essentially what our lungs do. Now consider those bellows becoming stiff, or the tubes leading to them becoming narrow. That's COPD in a nutshell. It's a long-term inflammatory condition that obstructs the flow of air in the lungs, making the simple act of breathing a challenge. It's important to understand that COPD is not a contagious disease. You can't catch it from someone else. It's a condition that develops over time, often due to prolonged exposure to harmful pollutants or smoking. So COPD is a serious lung condition that makes it difficult to breathe. But what causes it? COPD doesn't just happen. It's usually caused by long-term exposure to harmful pollutants or smoke. So what exactly triggers this condition? Well, the most common culprit is smoking. Yes, those cigarettes you light up are not just bad for your heart, but your lungs as well. But smoking isn't the only villain here. Long-term exposure to harmful pollutants like chemical fumes, dust, and air pollution can also lead to COPD. Imagine your lungs constantly battling these invaders. Over time, they get damaged and lose their ability to function properly. And it's not just environmental factors. Genetics can also play a role. There's a rare genetic condition called alpha-1 antitrypsin deficiency that makes people more susceptible to COPD. So if you have a family history of COPD, it's wise to be cautious. The causes of COPD are varied, but what are the telltale signs that someone might have this condition? COPD often develops slowly, with symptoms not being noticeable until significant lung damage has occurred. This stealthy development is what makes COPD a silent predator. One of the earliest and most common symptoms of COPD is a persistent cough. It's not your regular cough that comes and goes with a common cold. It's a cough that sticks around, sometimes producing a lot of mucus, often referred to as a smoker's cough. Next up is shortness of breath. It's not the out-of-breath feeling you get from a good run. It's a struggle to breathe, even when you're just doing everyday activities. This can progress to a wheezing sound when you breathe, signaling that your airways are getting narrower. COPD can also cause chest tightness, frequent respiratory infections, and fatigue. You may feel constantly tired, even after a full night's sleep. Lastly, unexplained weight loss can be a symptom, as severe COPD can increase your body's energy needs. Given these symptoms, how is COPD diagnosed and treated? Diagnosing COPD involves a series of tests, including lung function tests, imaging tests, and lab tests. Lung function tests are crucial in determining how well your lungs work, while imaging tests like chest X-rays and CT scans provide a detailed picture of your lungs. Lab tests, on the other hand, can help rule out other conditions that might be causing your symptoms. Now, let's move on to treatment. It's important to remember that while COPD is a chronic condition with no known cure, it can be managed. Medications such as bronchodilators and steroids can help to ease symptoms and improve lung function. Pulmonary rehabilitation, a form of therapy, can also be beneficial in managing the disease, teaching you exercises and strategies to breathe easier. Lifestyle changes are also key. Quitting smoking, avoiding lung irritants, and maintaining a healthy diet can go a long way in managing COPD. In severe cases, surgery may be an option. While COPD is a chronic condition with no cure, proper management can help improve quality of life and slow the progression of the disease.